And we'll give everyone just a little bit longer to join. And I will take the time to tell you that we do have everyone's microphone and everyone's camera turned off, only for security purposes. You can, we actually would love for you to type in your questions in the chat feature at the bottom right of your screen. And we'll answer those at the end of the discussion, at the end of the talk.
Great. All right. Well, hello, everyone. Thank you for joining us in our coronavirus webinar series. We are joined today with the Department of Psychiatry, the department head, Dr. Howard Osofsky. He also holds the Kathleen and John Brecker Chair, and we are joined by his wife, Dr. Joy Osofsky, who is the Paul J. Ramsey Chair of Psychiatry and the Barbara Lemon Professorship of Child Welfare. Thank you both for joining us. We're so grateful to have you with us. We're going to turn it over for you to talk to us about our mental health during this time of crisis.
Good afternoon. It's a pleasure. This is obviously Joy Osofsky. It's a pleasure for me to be able to join with my husband Howard to talk about the psychological and social impact of COVID-19. One of the things that we feel is very important is that, yes, it's a public health pandemic that's going on, but the mental health implications are very, very important. They're important now, and they'll be important for the long term. We have both had a lot of experience in preparation, response, and recovery from disasters. Did a great deal of work in the crisis counseling program. Actually, I was the head for child and adolescent services, and Howard was the head for adult services for Louisiana Spirit after Hurricane Katrina. COVID-19 is different from regular disasters, but we are using that experience to understand, try to help, and support others, which is what we're doing today. I am a clinical and developmental psychologist, and also in the Department of Pediatrics as well as psychiatry. But we'll be focusing on mental health issues in general. I want to start out by just sharing what the Dalai Lama said: time of greatest gain in wisdom is often the time of greatest difficulty. So we hope that we will see some positive things, even though at the moment everything looks quite negative. But we'll talk a little bit about that and what we need to think about in terms of mental health. So, you know, all of you listening, and we all know some of the worries that we're all experiencing at that time. Worry about getting sick ourselves. We certainly worry about our family and our friends. And in addition to getting sick, we worry about the many deaths that we've had, particularly in the New Orleans area and our state, as well as in many other states in the country. And one of the things that's been brought to my attention, since I also work developmentally, is, you know, how we help support adults, children, and families with deaths as well. In addition, economic and job concerns. So many people have been laid off. We're in lockdown. We're in stay-at-home mode. And so that puts a lot of stress and worries on all of us. Even shopping for food and necessities creates anxiety. How long is this going to go on? We don't really know. The news that we've been hearing is, you know, it may settle down some by June, but they're warning us about next fall and winter, so that contributes to worries. Maybe some of you at times feel depressed. Will it ever end? You know, then we have to deal with other kinds of things. Children are not in school. We worry about their education, but also have to take care of them at home at the time that we're balancing jobs and other responsibilities. Many of us are not used to educating our children and have had to take that on. Then there are a lot of concerns in families, elderly parents, relatives. Are they going to be okay? We can't see them directly. And with social distancing, all of these things are much more challenging. And I'm sure that those of you listening have other worries that you could add to our list here. So when we have so much stress, what are the kinds of things that come up for us? Difficulty keeping to a schedule. I don't know how all of you are doing with keeping to a schedule, and schedules and routines are very important to our lives, but it's been much more difficult. We're doing so much virtually at this point. We have to handle all kinds of responsibilities we haven't otherwise. And so I know Howard will be talking about the importance of routines and schedules also. Sleep problems are common. Difficulty getting to sleep, difficulty staying asleep, nightmares also. You know, and starting to do one thing and moving to another. That difficulty in concentrating, you know, then something pops up on your screen about one more update related to COVID-19. People who have chronic health problems have difficulty getting health care at this point, and so that's a worry as well as mental health conditions. People who already are struggling with anxiety or depression at this point, you know, can't get the kind of consistent help that they need, although we are virtually providing mental health service on a continual basis. One of the other worries that we have with the COVID-19 pandemic is use of alcohol and drugs, increased use of alcohol and drugs at this time, as well as tobacco. The other thing that is not on our slide that we're going to be seeing is an increase in abuse, child abuse and neglect, as well as an increase in domestic violence. Some of the information coming out of China in Wuhan, when they were under lockdown and the conditions were very cramped then as well as they may be now, that there was an increase in domestic violence. And some people said that maybe after the lockdown, you know, 9 months later, there would be more babies. That was not what happened. There were a lot more divorces when they came out of lockdown. So that kind of stress in families is something that can occur at this time. You know, we talk about social distancing. That's what we're supposed to do, the 6 feet apart or the 8 feet apart, social distancing. I wish, and those of us in mental health, I think, wish that they did not use the term social distancing, that rather we talk about physical distancing for safety, but emotional closeness, being able to communicate and be close to others is very, very important for support at times like this. So I'm going to now turn the slides over to Howard.
Okay. What I'd like to say is, as we divided this, what can we help to reduce stress at this time? One is I'd like to stress the importance of routines. They're hard to do, but routines are very important for both children and adults. It would be useful for yourself and the children if they include time for regular meals. Very often people tend to forget about it, skip a meal, or have snacks. Enough time for sleep in predictable times. With children, times to play with the children. It can be hard having the children there all day. And there are things they should be doing in their routines, but there also should be a set aside time to play with them, and also a time for self-care. It's important to plan breaks during the day. For example, if you're working, think of whether it's every hour or so just to take a stretching break, or a very brief time to take a tiny walk. Try to avoid distractions because they're going to occur very frequently. And try to keep them as much as you can from impeding on your life. Also, be sure to connect with others, with friends and family. In this time where we have much better technology, telephones, being able to connect with family and friends, and even friends in other states who are sharing similar experiences but with whom you've been close can be very important. The predictable schedules that will help. We have to remember that schools, Greek schools, and many child care centers are closed. So it means that kids are at home, children are at home, and they're getting their teaching remotely, which tends to differ somewhat from area to area and from ages. It can be very effective, or it can, with breakdowns, not work as well. But it is important that education continue. Adolescents in particular have many concerns about their education, their friends, and how to stay connected, and their futures, especially since one or both parents may have lost a job or had severe cutbacks in their employment. And they don't know, with their education, will they be up to date if they want to go on further? Will they qualify? But also, can the family afford it anymore? Or should they plan to give up more education and work? Businesses have been closed, which obviously changes routines for many people as well as their lives. If people are earning less money or very limited money, even now when people can collect unemployment, it isn't the same. And the question of whether the businesses will reopen. Social distancing, we mentioned that again. Emotional closeness is very important to support young children and caregivers, and you certainly can have both.
Importance of
Oh, the
self-care.
importance of self-care. I didn't see anything
We can't,
there.
it's hard to see the slide.
I wanted to say how important self-care is. I neglected it for the moment too, you can see. And it's hard to do that. Give time to yourself for self-care. Give time when you have a break from other people if you can, when you just by yourself for a little bit of time. Maintain your health. Take care of yourself through awareness, balance, and connection with friends or family. And it's important that you can nurture yourself or take care of yourself without guilt or shame. It's important to have some exercise at this time. If you can walk where you are or walk in your home, but it is really crucial, and it's important that you set aside a time for it, not let it take second place at times of the day. And recognize, it could feel like another pressure, but it isn't. It's difficult to find time to unwind and time to relax, but it is important. Try to remember to do some activities you'll enjoy, either by yourself or with a partner or with kids, but it's important that you do these. Connect with others, talk with people you trust about your concerns. One of the things that's a problem in New Orleans is not only what we've seen, the issue of equity with more blacks than whites getting the infection and also dying. But if we look in our poor neighborhoods in New Orleans, over 20% of people, I think it's 24%, have no internet connectivity at all. And another 14% have writing connectivity, but not verbal connectivity. And it is important that people be able to connect with one another. Here I'd say if one doesn't have that, the telephone can be very important. Just get on a call to some friends and be able to share with family members. We've been using it a great deal when people are in nursing homes, when family can't come in, to be able from the outside to stay connected with them. Don't hesitate to ask for help. There is help available, despite the disruption in so many things and the fact that so much is done remotely. And the help can be very effective remotely too.
So we've been thinking a lot about, as you know, the difficulties, mental health problems, social problems that are going on. It's always important, we learned with our work with disasters, to also think about positives, to think about things can build resilience, to think about things that help people even under very difficult circumstances. So one of the things, because we have to sometimes make more effort to connect, and also, frankly, because families are worried about each other too, we see more closeness in some ways. Well, I talked before about the difficulties at home where there can be an increase in domestic violence and arguing and those kinds of things, but we also see more closeness. People aren't running around all the time. They're at home, and if they're working out of home and dealing with relationships more in a positive way. So I think that's important. And then because we can't, meet for coffee or meet in the hall or something like that, it's much more reaching out to friends and families. I know certainly that's been an experience that we've had with our family, none of whom live here. Virtual reaching out, finding out how people are doing. And it makes us feel better too. So I think that's something that's been really interesting, and I'm interested to know what it'll look like in the long term if some of those positives, the closeness will continue. And then, we've had to do things in different ways. We've grown in new ways, new meanings, new values, worrying in different ways. We're certainly learning a lot about the world. We're certainly learning about how one can deal or in positive or negative ways, personally and professionally, with a very difficult circumstance like that. And there can be a positive related to that. Also, the issue of self-care is important anytime, but with COVID-19 pandemic, we've had to really figure out ways to do that. There's been, there are many apps for that. People are talking about it. And those are some of the kinds of self-care that are very common. The stress management, social support from peers, that's pretty simple. Pick up the telephone. You don't even have to do it using the internet. And we encourage that. And then being reflective. How do I feel about this? And instead of just, the negative, or I have to do this or that, sitting back and thinking, what are the changes that are happening? Are some of them positive or some of them negative, but being reflective in some ways. And I know that people sometimes, visualize very nice scenes that we can't be in those settings right now, but that's something that's helpful. Mindfulness is another self-help strategy that's quite helpful. And then we all talk about deep breathing, and Howard and I decided that we would actually, at the end of our time before we do questions, have all of you do a deep breathing exercise that's really very easy to do and really helpful and can calm us down. So I will ask everybody listening in to take a very deep breath through your nose and try to, when the breath goes in, have it go in your belly, called belly breathing. So take a really deep breath, and I'm going to count to 4 for that deep breath. 1, 2, 3, 4. And I hope you all have that deep breath that you feel in your belly now. And then what I would like you to do is very slowly, much more slowly than you took it in, to just breathe out through your mouth very slowly to the count of 6 or 8. 1, 2, 3, 4, 5, 6, 7, 8. The reason we wanted to do this exercise with you is it's really easy to do. Anytime, takes very little time, and I hope some of you may feel with that deep breathing, and you can do it again. I'm not going to have us do it again, that it really can be relaxing. I have to tell you that a number of my colleagues really have incorporated this into their lives. We actually incorporated into a big meeting last year with 3,000 people, and somebody stood in the front on this stage and had everybody do this. Takes about 2 or 3 minutes and makes a huge difference in terms of just being able to collect yourself and settle for a few minutes. So we wanted to just share that with you, and there are many other ways to do self-care. I'm sure some of you know them and experience them, but it's very, very important at this time. And the other thing that we want to emphasize as mental health professionals is there is also mental health support out there. We're doing our behavioral sciences center. Through our behavioral sciences center, we're doing virtual counseling, treatment, therapy, and helping to support people in any ways that they want. And we're talking about also through the Department of Psychiatry setting up more supports in collaboration with our work at all of the LCMC hospitals. And there's support going on right now for people who are our staff, doctors, nurses, residents, other staff who are working in hospitals. So we're doing what we can to help support mental health and mental wellness at this time.
We're working with Crystal to see if we can develop a further extension of mental health support on a high level involving faculty and advanced trainees. For example, for first responders, for other people who are very impacted in the community and in the state, even those for people who are worried that they're drinking or using opioids too much, and trying to see if we can provide further help.
So at this point, well, thank you very much for the opportunity to talk, and glad to stay and respond to questions.
Okay. I have a question, actually, just listening to y'all. We are, and just so everyone knows, you can type in your questions in the chat feature. If someone, so this might be a first-time need for some of our viewers. They may not have been connected to a mental health practitioner before. What are the steps that they take, or what's the first step they take to find someone to talk to?
Okay. We found after Katrina and the oil spill, where we played major leadership, but being up with people and destigmatizing. That's why I talked about doing something together with the foundation, if we can, to provide better access just by people calling in, not a hotline, but a support line, a true support line. There are many steps that one can do. If one is worried about it, there are the hotlines in the state. There's the suicide hotline, there are other things. As I say, we just feel there would be advantages to having something that's more comprehensive and with true professional involvement. I think if people can call and realize that it's not a stigma, and they're asking questions, and then they make a choice, unless it's urgent as they get into treatment, they make a choice if they would like some additional counseling at no cost, or if they need formal treatment, and that can be worked through. We can provide it at LSU, or we can refer to other providers in the community or the state, and try to be of maximum help in that way.
And one of the reasons that we would like to be able to set up a broader support line is, we understand that it's hard sometimes to call in for mental health support and to call into a clinic. But at this time, that may not be the need that somebody has. They may just, need to connect with someone in that way. And we know with usual disaster response, we're out in the field with people. And because of the social distancing regulations, we can't do that. But we'll try to make not just us, but all of us who are mental health providers make ourselves as available as we can.
After Katrina, for example, when we would go to districts, the temporary reopening, police districts, we go to the firehouses, we found that when people, and they were grateful, but after the initial first contact, we found that high numbers of them asked if they could get help for themselves and their families, an individual help, confidential help. And we would always say yes. And they would talk about the increased stresses on the families, the higher use of alcohol, arguing. And by the way, now the first responders, for example, if we can do this, as you know, there are higher incidences of infection, even of death in some of these groups. And the stresses on them and their families are very, very hard. And we're just trying to say, what can we do to be most helpful?
And it's not just to, when I'm thinking about some of those contacts that they necessarily had mental health problems, but things that were causing conflict in the family, like with children out of school now, there are a lot of issues related to education going on now, for one thing, and people out of jobs, those kinds of things. And just being able to talk to someone and try to problem solve a little bit with that could be helpful.
Mm-hmm. We have a question from a viewer. What is the best way to support someone who has just gotten off opioids, but you want to help prevent them from relapsing?
One of the things that I'm aware of, since I'm the director of a large portion of the state's response, and in trying to do the medication-assisted treatment and group treatment for people throughout the state. And obviously this has had to be switched to tele and remote treatment at this time. But we've been looking into how much of the current pressures may contribute to the pressures that leads to relapse, and how we can try to intervene with that. There are also people who for the first time are using or abusing, and how to have them feel comfortable getting help, and even refer them. It's called the SOAR, Louisiana State Opioid Response Program, throughout the state, and try and get them into very good treatment, or if they prefer, into some of the other clinical treatments in the state. We're going to try and make, and they're very enthusiastic about, as we try to do this warm support program, that this could help in identifying and being a support to people who are worried about either just having gotten off substances or just getting onto substances.
Okay, thank you. Something that I was thinking about when I was listening to y'all is about, you mentioned the people who are at home in possibly abusive situations. Is there any way that you feel like the public or mental health professionals can reach, maybe some of those children who are in those abusive situations and they can't really get away right now? How are you able to even reach them during this time?
Yeah, actually, we just had a long conversation yesterday with Department of Children and Families related to abuse, and talk with them about ways to reach out to coordinate actually a support line with them. That's an issue that's different from the domestic violence issue, and we're working with them to try to do what we can. They are actively involved with trying to follow up in whatever ways that they can related to abuse. Mm-hmm. With domestic violence, I know in some states, they've worked out ways, signals in various ways that where if abuse may be occurring, since the person may not be able to leave, probably can't leave or have anywhere to go to be safe, like we often have been able to do under those circumstances, some kind of codes that might be able to help them in some ways. I know in some states they've set up a number that you can, if you go to the pharmacy to get a necessity, just mention this number and get help in some ways. So we are working with people in the community to try to develop some of these strategies. And I know some of them are being developed, and we can pass them along to you so that people will more broadly be able to know about those.
The shelters will be available, and they'll be very highly used, or extremely highly used. But it is much harder, because if you're trapped in your home with an abusive partner who's controlling, and that it's hard to reach out for the help. And so it's the question of how to do it. The other thing we've been finding is neighbors may realize that it's going on and may report it too. So that I'm trying to be of help. But what Joy is saying is what we're trying to do is set up alternate ways of just identifying. I mean, I'm in a difficult situation.
And we know that some shelters are open with social distancing, but it's a question of how to get to the shelter at this point.
And if one reports it, then we hope, you know, there'll be help coming to the home to get the person out of the situation.
Okay. We had a couple questions come in. Any suggestions for online mindfulness resources?
Yes, I don't actually have the website right in front of me, but I can share them with you. And then I know this is being recorded. We could have a sheet of resources that we're glad to share. There are quite a few different sites out there.
Mm-hmm.
And what we'll do is send you a resource page that I did not attach here.
Okay, yeah, if you want to send that to me, I'll post it when I post the link to the webinar on our social media channels on our website. We can put it all there.
We'll do mindfulness. We'll also do some reflective practice kinds of things, and I'll put together resources in that area to post.
Great. Another question is, how do you feel mental health care coverage will change post the pandemic to be more accessible or cost effective?
I think it's very important. I can't answer everything, but I think one of the things we're going to find, we normally feel that things will get considerably better when the crisis is over. And I think that may well be true. There are some indications, however, that some types of things may not get better or may newly emerge when in quotes, the crisis is over, where people find they don't have the good jobs, that there are stores that are facing shutdown permanently, big chains, or that the kids go back to school and it's a tough adjustment, or that some of the relationships are hard to remake. And I think we've got to be very careful to be aware of that and to know that symptoms of post-traumatic stress, sometimes of grief, because people know friends or family members, not only who have the illness but who died, or are having lasting medical sequelae, or even just grieving what is changed in their lives, because there are many changes that aren't going to come back to the way things were. To try to be available, to be supportive, and to realize people at times may be more depressed and be very attuned to that. And also, we expect that, one of the things we found after Katrina and the Gulf oil spill is the patterns of recovery were slower than had been reported after other disasters, given the scope of the disaster. But they were occurring, and then people were hit by another, but we also saw normal patterns of resilience and strength. And we expect to see that part of it here. But this is a pandemic, so it's not even as though there are other parts of the region or the country that have been spared this, so that the recovery will be more complicated. And so we've got to have the services available.
I mean, I think one of the things that we need to be aware of is those people who've experienced previous trauma, previous difficulties and trauma, the pandemic, COVID-19 may have more of an impact on them, may bring back some difficult times, that type of thing. And so that's something that we need to be aware of. By the way, you had mentioned mindfulness, and I will give you a group of resources, but one of the apps that people have found really helpful just in general is something called Calm, C-A-L-M, just Calm. And it has a lot of different resources on that. And then I will share some of the mindfulness apps that we recommend. But it's really easy. It doesn't take a lot of time, and it can help a lot, even if you give yourself 5 minutes at this time.
Okay. We had 2 more questions come in. For those who haven't experienced depression prior to this crisis, what should they look out for as signs or red flags?
I'm sorry, I didn't hear. I'm sorry, we couldn't hear.
Okay. For if anyone hasn't experienced depression before, what are signs that they should look for as red flags?
Depression.
Oh,
If they had depression before,
Yes.
what to look for?
They're likely to continue having depression. It may be worse because here they're, in addition to what has been going on with the depression, you have life changes that contribute to depression. And people come in and we see who are so worried about on top of everything, the effects of the virus and what it's going to mean to them and what it's doing to their capacity to get care. We want to make sure that people who are taking medications continue the medications and that they get in touch with their provider, unless the provider is not accepting patients at this time, and then we'll provide the name or do it ourselves. By ourselves, I mean the medical center.
Dr. Howard. Dr. Howard.
They truly need help, and we work closely with AA, with the 12-step program. I also think, I was speaking to the state earlier this week, the state response begins primarily with people 18 and older, and there's supposed to be education for adolescents and younger children. I've asked if we could play a greater role in that because this, especially with young people, we're going to find that alcohol is a common, alcohol and marijuana are the 2 things they turn to. And with depression, if one is using alcohol at a time when one has binged, one may even consider, whether it's time to end it all. So it's very, very important. And it's important that all age groups, we be aware of it, we be aware of the increase in alcohol. If you track one of the businesses that does well with the disaster, and it's doing well here, is the sale of alcohol.
We actually saw that after Hurricane Katrina as well. That is a risk. But I think if somebody has been depressed and, this is making them feel more seriously depressed, reach out. We're very accessible. We can't on it in person, but we do virtual work all the time. And
the only one
we can
thing
take care of that.
Is when we're working with somebody, if there is an imminent danger of suicide or homicide, and suicide obviously would be more common. That is the time when we do have to collect additional. We have to report it and try and get someone.
And there will be additional help at this time. Yes.
Joy, I think the other part of the question is, what if they didn't have any issues with depression prior to this current situation, and they're concerned that perhaps they are, experiencing depression but have never dealt with it before. So what are some of those early signs, red flags that perhaps you are experiencing depression and may need medication or the help of a professional?
Well, I think it's really, everybody is experiencing some mental health change. I shouldn't say everybody, but many people are experiencing some mental health changes at this time. I think, some of the signs of depression, having difficulty getting up in the morning, not feeling motivated to do anything, feeling very concerned about things all the time, not wanting to connect with other people, withdrawing, those types of things those types of behaviors would be of concern at this time.
And even irritability and anger that can be signs of depression. So
Anger and anger, irritability, and depression go hand in hand.
Right.
You see that at times.
And as I was saying, difficulty getting up in the morning, getting going, not even wanting to get up and attend to what you need to do.
Okay, thank you. That's wonderful information. I feel, you know, each of these webinars that we've hosted have had such tremendous information to give at such a trying time for all of us. And I feel grateful to be a part of them and to have heard your presentation. I know in the beginning, as you went through each question, I felt the weight of each one that you presented as I've pondered, you know, each of those questions and felt how it's dramatically changed my life and shifted how I go about my day-to-day. It's very, very challenging. We're grateful to have you as part of our LSU Health family to help support us through this. And thank you for giving of your time.
Well, thank you.
We're glad to be
I can
out.
also tell you that with some of the psychological first aid that we've been providing our psychology division in the hospitals, people at the end of just the hour will say they feel as though a weight has been lifted. So that whatever we can do to help, we're glad to do.
Yeah.
Thank you very much.
We're glad to
Thank
have
you
the
for
opportunity to help. Yeah, we appreciate you reaching out too.
Yes.
Sam, do you have some information of our upcoming webinar?
Yeah, I did just post the website, the URL where you can actually watch all of our past webinars and you can sign up for our future ones. Our next one is next Tuesday with Dr. Joseph Cantor, and he is the Assistant Health Officer at the Louisiana Department of Health. So he's gonna give us a rundown of what's going on currently. That's next Tuesday at 1 p.m. So that is everything, and we really appreciate y'all coming. Thank you, and we hope to see you next Tuesday.
Thank you.
Thanks, everyone.
Thank you.
Bye.
Take care.
Be well.
It was awesome.